Hi everyone, welcome to my channel. I am the Nurse Doc Tutor Asia, and this channel is dedicated to helping you pass nursing school. So today's lesson will be on hypothyroidism and hyperthyroidism. So if you are struggling to understand the difference between the two, then guess what? This video will bring you so much clarity. So at the end, we will have practice NCLEX questions. So go ahead and share this with your classmates so you all can pass your exam together. So first, let's start talking about the thyroid gland. So where is your thyroid located? It is located in your neck, and it has a butterfly shape. So what is the thyroid gland responsible for? So it is responsible for producing two key hormones, which you have T3, and that hormone plays a crucial role in regulating metabolism, heart rate, and body temperature. And then you have T4, which is a precursor hormone that converts into T3 in the body as needed. So it is so important to know the role of the thyroid gland. So it is located on the neck, and it has a butterfly shape, as in this picture that's on the screen now. So let's talk about hyperthyroidism first. So let's talk about a few signs and symptoms that you will see in a patient with hyperthyroidism. So this patient will experience weight loss because excess thyroid hormones increases your metabolic rate, which causes the body to burn calories faster than normal. This patient will have a heat intolerance due to that elevated metabolism, which it produces excessive heat, making the body less tolerant to external warmth. This patient can have nervousness and tremors because it stimulates the sympathetic nervous system, and this can lead to heightened anxiety and tremors. Also, it could lead to tachycardia and palpitations because of the increased levels of T3 and T4, which can raise the heart rate and the force of contraction. You also can see bulging eyes in this patient, especially you will see these in our patients with Graves' disease. And this is the autoimmune inflammation, which causes the tissues behind the eyes to protrude. So you'll be able to see that in your patient. Also, you will be able to see localized edema. Women could have problems with their menstrual period. Patients can also have diarrhea. And also you will be able to see an enlarged thyroid. So around here, you will be able to see a bulging here. We call it a goiter. You will be able to see that in patients with hyperthyroidism. All right, so treatment for hypothyroidism, medications such as anti-thyroid drugs such as PTU and methylbomazole, and they block the thyroid hormone production. Also, patients can be on beta blockers such as propranolol to manage symptoms like rapid heart rate. Patients also can have they can get radioactive iodine, which that destroys the overactive thyroid tissue. And patients can also have surgery that you can have removal of part or all of the thyroid gland. Now, when it comes to removing the thyroid gland, you want to watch out for complications like low sodium and laryngeal spasm and things like that. So that is an NCLEX plug, you guys. So if a patient has their thyroid removed, that you want to watch out for signs and symptoms of low calcium, and you also want to look for that laryngeal spasms after surgery, okay? So what are some nursing interventions that we're going to do? So we're going to make sure that we're monitoring our patient's vital signs, right? For that fast heart rate, that high blood pressure and fever, but we want to administer medications as ordered. We want to provide comfort, so we may use cooling methods for fever. We want to reduce stress in the environment. We want to make sure that we are monitoring the patient's TSH levels, T3 levels, and T3 and T4 levels, and liver function. And we want to encourage nutrition, so adequate calorie intake due to increased metabolism. Now, let's talk about a thyroid storm or a thyroid crisis. So, this is a rare, but it is a life-threatening exacerbation of hyperthyroidism, typically seen in individuals who are undiagnosed or they poorly manage their hyperthyroidism. So, what are some signs and symptoms of a thyroid storm? You can see agitation, abdominal pain, vomiting and diarrhea. They will have a really high fever. You can see tachycardia, arrhythmias, and even heart failure. So, what are you going to do if a patient is in a thyroid crisis? So, we're going to administer beta blockers to control the heart rate. We're going to give them their anti-thyroid medications. We're going to put them on some corticosteroids to reduce the inflammation and block the conversion of T4 to make more T3, right? So we're going to just block the conversion of that. We're going to do cooling measures for the hypothermia, including giving them medications to bring down their fever, and we could do external cooling techniques. And also we want to do supportive care such as IV fluids and oxygen administration needed to stabilize the patient. So this is a emergency, you guys. So a thyroid crisis is a medical emergency and that requires immediate treatment, okay? Now, let's talk about hypothyroidism. So what is the pathophysiology of hypothyroidism? So that is an underproduction of T3 and T4 hormones. So this one now is an underproduction, not producing enough T3 and T4 hormones. So what are some causes? Hashimoto's thyroiditis, which is also an immune disease, iodine deficiency, or if a patient had thyroid surgery. So what are some nursing interventions that we're going to do for a patient with hypothyroidism? So we're going to make sure that we're monitoring their vital signs, right? We want to check for the slow heart rate and low blood pressure. We want to administer medications as ordered. So a common one is levothyroxine, also known as Synthroid, and we'll talk about that in a couple slides. We also want to provide warmth for the client. We want to ensure that the patient stays warm due to their cold intolerance. We want to encourage nutrition. We want to promote a balanced diet as weight gain may occur. We want to make sure that we're tracking and monitoring the patient's weight for weight gain or weight loss. We want to promote activity. We want to encourage light exercise to help reduce muscle weakness and fatigue. We want to provide emotional support and coping strategies for these patients. And we want to make sure that we educate the patient and teach them about the medication side effects and regular follow-ups, okay? So let's talk about levothyroxine. So you will give this medication pretty commonly in the hospital. So let's dig into it. So levothyroxine basically provides the thyroid hormone that the body is lacking, which helps regulate metabolism, energy levels, and growth. It can be given PO or IV administration. So let's talk about some important nursing considerations with levothyroxine. So administration, you want to make sure that you take it on an empty stomach. And it's usually given in the morning, 30 minutes before food for best absorption. You do not want to crush or chew the tablets. And you want to make sure that you're monitored for effectiveness. So you want that patient will get regular blood tests done, their TSH and their T4 levels, just to make sure they have the right dose. So just let your patient know that, hey, you will have to come in for some blood work and stuff like that. You want to watch for signs and side effects. So overdose can happen and can cause hyperthyroid-like symptoms, such as palpitations, weight loss, tremor, and anxiety. So you want to let your patient know that. Also, you also want to educate your patient to take this medication consistently every day at the same time. You want to avoid switching brands of the medication unless it is advised by the doctor. And if you are experiencing any chest pains or palpitations, you want to report that to the healthcare provider. All right, so let's talk about mixed edema coma. So mixed edema coma, this is when severe hypothyroidism causes hypothermia, respiratory depression, hypotension, and bradycardia. So what are some things that can cause this? So this could be severe untreated hypothyroidism if a patient has an infection, trauma, cold exposure, or sedatives can trigger a mixed edema coma in those with hypothyroidism. So this is really, really important, and it is really serious. It is an emergency. So what are some signs of a mixed edema coma? As we mentioned earlier, hypothermia, bradycardia, hypotension, respiratory depression, confusion or delirium, severe lethargy, or coma. They could also have a puffy face and thickened skin due to fluid retention, you guys. So this is a medical emergency. So what are we going to do? We are going to give IV levothyroxine. So we're going to get rapid thyroid hormone replacement. Okay, that's going to be given IV. We want to give supportive care such as IV fluids to maintain blood pressure. We want to warm the patient to treat the hypothermia, such as using warming blankets. We want to monitor the respiratory function and provide oxygen as needed. And then we want to treat the underlying cause. So if there is an infection or there is trauma, we want to treat whatever has caused this mixed edema coma. All right, you guys, so we have learned about hypothyroidism, hyperthyroidism. We learned about thyroid storm. We learned about mixed edema coma. So now let's put what we learned to work. Let's do some NCLEX questions. So the question says a client is admitted to the emergency department and has a diagnosis of mixed edema is made. Which action should the nurse prepare to carry out initially? So that means what should she do first? Should it be A, warm the patient, 2, maintain a patent airway, 3, administer thyroid hormone, or 4, administer fluid replacement? So I'm going to give you some time to think about it. So if you chose 2, you are correct. So remember, with the mixed edema coma, it can cause respiratory depression. So remember, ABC, airway is first. We must maintain a patent airway. The nurse is preparing a client with a new diagnosis of hypothyroidism for discharge. The nurse determines that the client understands discharge instructions if the client states which signs and symptoms are associated with this diagnosis. Select all that apply. Is it 1, tremors, 2, weight loss, 3, feeling cold, 4, loss of body hair, 5, persistent lethargy, 6, puffiness of face. So I'm going to give you some time to think about it. So if you chose 3, 4, 5, and 6, you are correct. 3, 4, 5, 6, you are correct. The nurse is monitoring a client with Graves' disease for signs of a thyroid storm. Which signs or symptoms, if noted in the client, will alert the nurse to the presence of this crisis? Is it 1, fever and tachycardia, 2, pallor and tachycardia, 3, agitation and bradycardia, or 4, restlessness and bradycardia? So if you chose 1, fever and tachycardia, you are correct. A client has abnormal amounts of circulating T3 and T4. While obtaining the health history, the nurse asks the client about the dietary intake. Lack of which dietary element is most likely the cause? Is it 1, iodine, 2, calcium, 3, phosphorus, 4, magnesium? So I'm going to give you some time to think about it. So if you chose 1, you are correct. So adequate dietary iodine is needed to produce T3 and T4. A client has overactivity of the thyroid gland. The nurse should expect which finding? 1, weight gain, 2, nutritional deficiencies, 3, low blood glucose level, or 4, increased body fat storage. So I'm going to give you some time to think about it. So if you chose 2, nutritional deficiencies, you are correct. So although the client may experience an increased appetite with overactivity of the thyroid gland, food intake does not meet energy demands and nutritional deficiencies can develop. All right, that is a wrap. So I hope you guys gained all the nuggets, all the information. I hope that you now understand this topic a little bit better. But if you are still struggling, hit me up in the comments and then we will work it out together. So if this is your first time here, I just want to thank you for stopping by my channel, and go ahead and hit the subscribe button and share with your classmates so you all can pass nursing school. This channel is dedicated to helping you pass nursing school. Thanks for watching. See you in the next lesson.